Hello, I'm here with Tina Alders, nurse practitioner here at Houston Methodist Hospital, and we're going to discuss issues of depression today. Tina has a Master's of Science and a Bachelor's of Science in Nursing, and she has had focuses in psychology, specifically dealing with depression issues. As you know, depression affects many people in different ways. Um, how hard is it to diagnose someone with depression issues?
It can be very difficult to diagnose somebody with depression because first you have to rule out whether or not there is a physical cause that's going on, if it's something just as simple as a nutritional imbalance versus something more of a brain chemistry imbalance. And the other difficulty with diagnosing people with depression is most folks with depression tend not to seek treatment.
Okay, and as far as treatment, are you more focused? Would you recommend treatment with medication or with therapy?
My personal first is to look at your cause, because if it is, sometimes it can be something just situational and temporary, and finding out what your cause is in that situation. It could be just a matter of something, just an immediate crisis has happened that's led to this depression, finding behavioral modifications to treat it versus going straight to pharmacological means. Because if you don't treat sometimes your cause, whether it be your lack of exercise, your poor diet, your lack of outdoor activity, your lack of family enjoyment, no amount of medications is going to treat you.
Okay, that makes sense. Do you feel that depression is easier to diagnose in women than in men? Do you feel that men are more or less open about their psychological or emotional issues than women are?
I feel women will be more likely to seek treatment. So therefore, just by odds of ratio, more women seek treatment. Therefore, it seems easier to diagnose in women than it is in men. Men are taught from a very early age, men don't have feelings, men don't cry, men don't talk about their stuff. So therefore, most men don't seek the treatment because they feel it will interfere with essentially their manlyhood to admit they're having an issue. So is it easier or harder to diagnose? I don't believe it's easier or harder in either gender. It's just you see it more proportionately in women because women are more likely to seek help.
Okay, and how do we look at depression in children? Primarily children between the ages of 6 and 10. Do you see that very often, and how would you even know how to look for the signs in depression in children of those ages?
That I can't really answer to because my specialty is adults. I have no training or education really in doing anything on the pediatric side.
Okay, cool deal. Back to adults. What in the treatment, pharmaceuticals, what medications are normally prescribed for treatment of depression?
Um, Lately, it's been a lot of the serotonin reuptake inhibitors, the SSRIs, like your Wellbutrins, I always mispronounce, but you also have your Prozac in there, and those type medications are the typical go-to. Wellbutrin, Prozac, Celexa, those tend to be the number one pharmaceutical push for depression medications right now.
And have you noticed that with depression, is there also usually a co-diagnosis for bipolar disorder as well? Do they tend to go hand in hand?
They do. They tend to go hand in hand. That's part of the bipolar is the manic and depressive. So to have bipolar, you have to have at some point in time have the diagnosis of depression. But what you find with people who are bipolar, when they are in their manic episodes, a lot of them like that because they feel so alive during that's not when they want help. And when they're in that manic episode, they don't want to take their medications. They don't want to numb those feelings of euphoria that they're feeling. So they do tend to go hand in hand quite a bit.
Which makes sense, and me being a survivor of, I wouldn't say a survivor, but a patient who's had a diagnosis of both depression and bipolar disorder, I did notice on my manic phases that I didn't seek out help the way that I should,
Mm-hmm.
but I knew in the back of my mind that I needed to stop, because my manic phases I tend to spend and overspend, but when I fall hard, and it's a very, very difficult, balancing act, and it's not easily managed without medication. One thing I do notice, is that I always say to anyone, because we work here, for those of you who don't know, we're on the neurology floor, and I always tell people that there is a fine line between psychiatry and neurology. Do you agree with that statement?
There is. There is a very fine line between the two. There is a lot that we don't understand still when it comes to the brain. And even just the manner of how you think about something and how you feel about something can almost physically change than how your synapses are firing, because you are now laying down new synapses tracks due to, such as someone who has chronic negativity. If you ever notice someone who has a lot of chronic negativity, they also tend to suffer from a lot of chronic health problems. Then which one came first? The poor thinking, the sadness, the depression, and then the health problems? Or did the health problems lead to the chronic negativity thoughts? So there is a fine line between the two. I mean, any organic brain disorder, having a tumor growth or anything like that, well, that's affecting your synapses, that's affecting your brain chemistry. Therefore, it could affect your mental state. I mean, there's numerous counts of people who suffer frontal lobe damages and go from being the good-faring Christian pastor to the drunken sailor, just from frontal lobe damage. Yeah, Phineas Ferb, look that one for the road spike through the brain.
Really? Okay, that's very interesting. So, from our conversation, in just this interview, I can see that our mental health is very much correlated with our physical health, and if our mental health is not together, then as a whole we won't be together.
Correct.
Okay.
But just like we use a lot of antidepressant medications to treat other physical problems, it is one of the main treatments used in pain management to address pain therapy. It's one of the main treatments for fibromyalgia as antidepressant medications.
Wow, very interesting. Well, Tina, as we affectionately call you, I would like to thank you for your time and your
Yes.
patience. This was wonderful. My class at HCC thanks you. Thank you again.
Yes.